Hello everyone, welcome to my channel Dr. Shil's Physio Victory. Today we will discuss about previous year questions of CUET PG 2024. Let's start. Today's first question is: the musculocutaneous nerve does not supply option 1 coracobrachialis, option 2 pectoralis minor, option 3 long head of biceps brachii, and option 4 short head of biceps brachii. Here the correct answer is option 2 pectoralis minor. Pectoralis minor is basically supplied by the medial pectoral nerve. Root value is C8 to T1. The other options are basically supplied by musculocutaneous nerve. Next, come to question number 2. Superior oblique and extraocular muscle is supplied by which cranial nerve? Option 1 trochlear, option 2 abducens, option 3 facial, and option 4 oculomotor. Here the correct answer is option 1 trochlear. Trochlear now basically supplied the superior oblique muscle. One thing you should remember that SO4, LR6 and AO3. SO is for superior oblique, is supplied by cranial nerve 4th, that is 4. LR for lateral rectus is supplied by 6, that is 6th cranial nerve, and all others are supplied by cranial nerve 3, which is oculomotor. Oculomotor supply all others. Facial is for facial expression basically. Expressions. Abducens is for lateral rectus, and trochlear is for superior oblique. Now through this image we'll understand basically superior oblique primarily functions intorsion. Intorsion is internal rotation of the eyeball, that is superior oblique is this side is medial side, lateral side. So this medial or internal rotation of the eyeball occurs due to superior oblique muscle. Next, come to question number 3. Superior gluteal nerve supplies the following muscles. Option 1 gluteus maximus, option 2 gemellus inferior, option 3 obturator internus, option 4 tensor fascia lata. Here the correct answer is option 4 tensor fascia lata. Basically tensor fascia lata is supplied by the superior gluteal nerve. Gluteus maximus is supplied by inferior gluteal nerve. Gemellus inferior is supplied by nerve 2. Quadratus femoris and obturator internus is supplied by nerve 2. Obturator internus. Next, come to question number 4. Aplastic anemia is due to option 1 disorder of red bone marrow, option 2 iron deficiency, option 3 vitamin B12 deficiency, and option 4 folic acid deficiency. Here the correct answer is option 1 disorder of red bone marrow. Aplastic anemia is a bone marrow failure disorder which is characterized by reduced RBC, reduced WBC, and also reduced platelets. Iron deficiency is leading to microcytic hypochromic anemia. B12 deficiency leads to megaloblastic anemia, and folic acid is also leads to megaloblastic anemia. Next, come to question number 5. Fick's principle is used as a option 1 method of measurement of vital capacity, option 2 method of measurement of tidal volume, option 3 method of measurement of cardiac output, option 4 method of measurement of blood volume. Here the correct answer is option 3 method of measurement of cardiac output. Cardiac output is equals to oxygen consumption by atrial oxygen content minus venous oxygen content. Next, come to question number 6. The correct formula for alveolar ventilation is option 1 tidal volume plus dead space into respiratory rate, option 2 tidal volume minus dead space into respiratory rate, option 3 tidal volume plus dead space divided by respiratory rate, option 4 tidal volume minus dead space divided by respiratory rate. Here the correct answer is option 2 tidal volume minus dead space into respiratory rate. Basically option 2 is the correct answer. It is denoted by V alveolar ventilation is equals to Vt minus VD into respiratory rate. VT is tidal volume, VD is dead space volume, and RR for respiratory rate. Next, come to question number 7. The protection furnished by society to its members through a series of public measures against social and economic disaster is called as option 1 social welfare, option 2 social security, option 3 social work, option 4 social reform. Here the correct answer is option 2 social security. Social security refers to the system of public measures taken by the state to protect individuals from social and economic risks such as unemployment and old age, industrial injury, etc. Next, come to question number 8. Which of the following is major effect of Vrikshasana pose in yoga? Option 1 gives a sense of balance. Option 2 strengthens upper limb muscles. Option 3 improve flexibility of the trunk. Option 4 improves breathing. Here the correct answer is option 1 gives a sense of balance. This is the image of Vrikshasana. It improves static balance, enhance proprioception, increase neuromuscular coordination, and promote postural control. Next, come to question number 9. According to the Piaget's stages of cognitive growth, emergence of language is major hallmark of option 1 sensory motor stage, option 2 pre-operational stage, option 3 concrete operational stage, option 4 formal operational stage. Here the correct answer is option 2 pre-operational stage. According to the James Piaget, cognitive development occurs in 4 stages. These are basically 4 stages. Sensory motor stage, age is, I will write age, and here is key features. Sensory motor stage is from 0 to 2 years, and key feature will be object permanence, pre-operational stage is from 2 to 7 years, language and symbols are key features. Concrete operational stage is from 7 to 11 years. logical thinking is the key feature, and for formal operational stages for 11-year plus abstract reasoning is the key feature. Next, come to question number 10. The action of biceps brachii muscle on the elbow joint is an example of which class or order of lever? Option 1, first order of lever with mechanical advantage. Option 2, first class lever order with mechanical advantage. Option 3, that is mechanical disadvantage. Option 3 is second class lever, or option 4 is third class lever. Here the correct answer is option 4, third class lever, because in elbow joint, biceps basically works here. Elbow joint works as fulcrum, hand and arm works as load, and biceps works as effort. So the effort arm is less than the load arm, so mechanical advantage is minus, that is third order lever or third class lever. Next, come to question number 11. The paralysis of dorsiflexor of the toe will result in dash of the affected extremity, and there could be dash during swing phase of gait. So dorsiflexor of the toe results in functional lengthening. So there is also functional lengthening, there is also functional lengthening. Next, there could be dash during swing phase, increase of knee and hip flexion. So there is only increase of knee and hip flexion. So option 2 is the correct answer. Next, come to question number 12. The superior zygophysial facet is an typical in a typical lumbar vertebra faces dash, and inferior zygophysial facet faces dash. Their orientation limits dash. Here the correct answer is option 3. Superior zygophysial joint faces anteromedially, inferior zygophysial joint faces posterolaterally, and their orientation limits lateral flexion and rotation. Here is the image. So this is superior zygophysial facet, which is basically anteromedially, and this is inferior zygophysial facet, which is posterolaterally. Next, come to question number 13. In which of the following does not cause edema? Option 1, decrease plasma oncotic pressure. Option 2, decrease capillary permeability. Option 3, lymphatic obstruction, and option 4, increased capillary hydrostatic pressure. Here, the clear answer is decreased capillary permeability, because edema occurs when hydrostatic pressure increases, capillary hydrostatic pressure increases, lymphatic obstruction and decrease plasma oncotic pressure when increase capillary permeability. Next, come to question number 14. Which of the following is the most important rate limiting enzyme of the glycolysis pathway? Option 1, phosphohexoisomerase. Option 2, phosphofructokinase. Option 3, aldolase. Option 4, glyceraldehyde 3 phosphate dehydrogenase. Here, the correct answer is phosphofructokinase. Phosphofructokinase, basically it is a irreversible step committed, and it is a committed state of glycolysis, highly regulated. Therefore, it is a rate limiting enzyme of glycolysis. It basically activated by AMP and ADP. Next, come to question number 15. Dash is considered as an essential component of a rehabilitation program to reduce the risk of musculoskeletal injury or re-injury during activities that involve high intensity, deceleration, and quick changes of direction. Option 1, isokinetic training. Option 2, eccentric training. Option 3, concentric training. Option 4, isoinertial training. Here, the correct answer is option 2, eccentric training. Eccentric muscle contraction occurs when a muscle lengthens while producing force, which is exactly what's needed to control deceleration and absorb high loads during landing from jumps. Because many sports injuries occurs during deceleration, eccentric training is essential to reduce injury and re-injury risk. Isokinetic training is speed controlled, useful for assessment, but less specific to real world deceleration. Concentric training is shortening action, important for propulsion, and isoinertial training is for constant external load. Next, come to question number 16. The corrective exercise for diastasis recti is Option 1, head lift in supine position with patient gently approximating the rectus muscle inferiorly with the crossed arm. Option 2, head lift in supine position with patient gently approximating the rectus muscle towards midline with the crossed arm and doing straight leg rising with ab- abducted lower extremities. Option 3, head lift in hook lying position with patient gently approximate the rectus muscle towards midline with the arm cross crossed arms. Option 4, repeated abdominal crunches in supine line. Here the correct answer is option 3, head lift in hook lying position with patient gently approximating the rectus muscle towards midline with the crossed arm. Diastasis recti is also known as abdominal separation, which is commonly defined as a gap of roughly 2.7 centimeter or greater between two rectus abdominis muscle. These are the types of different variations in diastasis recti. Is open diastasis, only the navel area. Open below navel diastasis is below navel. This is above navel. This is completely open diastasis recti. Next, come to question number 17. In medial glide to the subtalar joint of the foot is used to increase option 1 eversion, option 2 inversion, option 3 dorsiflexion only, option 4 plantar flexion only. Here the correct answer is eversion, option 1 eversion. This is the image I have taken from our exercise book. Medial glide to increase eversion, lateral glide to increase inversion. This is subtalar joint. In subtalar joint, calcaneus is convex surface and talus has a concave surface. Next, come to question number 18. Monophasic sinusoidal currents introduced by Perry Bernard are called as option 1 HVPGs, option 2 galvanic current, option 3 Faradic current, and option 4 diadynamic current. Here the correct answer is option 4 diadynamic current. Diadynamic current is a monophasic sinusoidal current derived from rectified alternating current. Frequency is around 50 to 100 Hz depending upon the time. Mainly used for pain relief, muscle stimulation, and circulation improvement. Next, come to question number 19. During the application of cold packs, the skin temperature is usually around option 1 below 0 degree, option 2 0 degree, option 3 5 to 10 degree, option 4 16 to 18 degree. Here the correct answer is option 3, that is 5 to 10 degree. During cryotherapy, skin temperature gradually falls due to heat transfer from skin to the cold pack. Next, come to question number 20. In ultraviolet radiation therapy, E3 is option 1 2.5 times of E1, option 2 5 times of E1, option 3 10 times of E1, option 4 12 times of E1. Basically, the correct answer is option 2 5 times of E1 is basically E3, it is E2, it is E4. Next, come to question number 21. Pressure is generally used to hasten scar maturation and to minimize scar hypertrophy during healing of burns, but it may not be required in the case of option 1 if wounds heal in less than 10 to 14 days, option 2 if the scar is less than 6 months old, option 3 if skin is grafted over the wound area, option 4 if scar is still red and shows evidence of vascularization. Here the correct answer is option 1 if wound heals in less than 10 to 14 days. Next, come to question number 22. A recommendation for developing and maintaining cardiovascular fitness in healthy adults is option 1 3 days per week for 40 minutes per day at an intensity of 10 to 11 on the PRE and RPE Borg scale. Option 2 3 to 5 days per week for 20 to 60 minutes per day at an intensity of 12 to 16 on the RPE scale. Option 3 5 days per week for 60 minutes per day at an intensity of more than 16 on the RPE. Option 4 3 days per week for 20 minutes per day at an intensity of 10 to 11 on RPE. Here the correct answer is 3 to 5 days per week, 20 to 60 minutes per day at an intensity of 12 to 16 on the RPE. The correct answer. Next, come to question number 23. Which of the following are not the age-related physiological changes? Option 1 loss of motor neurons, option 2 reduction in size of fast twitching type, this is type 2 fiber, option 3 reduction in size of slow twitch type 1 fiber, and option 4 increase in non-contractile tissue. Here the correct answer is option 3 reduction in size of slow twitch type 1 fiber. Basically, with age or sarcopenia, typically neuromuscular changes occur is loss of motor neuron, preferential atrophy of the fast twitching type 2 fiber, and increase in non-contractile tissue. Slow twitching or type 1 fibers are relatively preserved compared to type 2 fibers. Next, come to question number 24. Which of the following is incorrect regarding botonier deformity. Option 1. It occurs due to rupture of the central slip of the extensor mechanism as a result of trauma or inflammation. Option 2. There is hyperextension deformity at the PIP joint and flexion deformity at the DIP joint. Option 3. Uh, sleeping is a splinting is the first option in closed injuries and in early rheumatoid pathology. Option 4. Surgical repair and reconstruction is uh, required in cases of severe is reconstruction is required in cases of severe and total rupture. Here the correct answer is option 2. There is hyperextension deformity of PIP joint, flexion deformity of actually this is swan neck deformity, not a botonier deformity. This is the image of swan neck deformity. This flexion of DIP and hyperextension of PIP, and this is botonier deformity where flexion of PIP and hyperextension of DIP. Next, come to question number 25. In cervical upper cross syndrome, option 1, deep neck flexors are strong. Option 2, deep neck flexors, rhomboids and serratus anterior are weak. Option 3, pectoralis major and minor are weak. Option 4, lower trapezius is strong. Here the correct answer is option 1, deep neck flexors are strong. This is the basically image of upper cross syndrome. In upper, there is one second. Weak deep neck flexors and weak lower trapezius and serratus anterior and tight pectorals and tight upper trapezius and levator scapulae. Thank you everyone for watching this video. Please do like and subscribe and press the bell icon. If you found anything wrong or incorrect, please pin me on the comment box. Bye bye.